Hello everyone, I am Dr. Deepa. Today we are here to learn about the larynx as we have already discussed about the skeleton of the larynx, the framework of the larynx, the formation of the cartilages, the ligaments, membranes and the muscles which make up the larynx in our previous video. In this video, we will be mainly looking onto the cavity of the larynx, the nerve supply, the arterial supply and the clinical importance of the larynx. As we all very well know that larynx is the organ of the phonation, hence called as the voice box. This larynx makes up the uppermost part of the lower respiratory tract and the function mainly include the respiration, the phonation, protection and the deglutition. So moving on to the cavity of the larynx. This is the atlas picture showing the interior of the larynx as we can make out the larynx here which is seen to extend from the laryngeal inlet above directed downwards till it reaches the lower border of the cricoid cartilage. So this is the extent of the larynx, that is from the inlet of the larynx or the laryngeal inlet tracing straight down to reach the lower border of the cricoid cartilage. So this entire larynx, the cavity of the larynx is divided into three parts. The inlet of the larynx or the laryngeal inlet is mainly bounded anteriorly, as we can see over here. It is bounded anteriorly by the upper half of the epiglottis, which is one of the unpaired cartilages of the larynx. So here what we see is the epiglottis which makes up the upper and the anterior boundary of the laryngeal inlet. Posteriorly, the inlet is formed by the interarytenoid fold of the mucous membrane, and on either side along the lateral side as seen here, the inlet is completed by the araepiglottic folds of the mucous membrane. So the inlet is bounded on either side by the araepiglottic fold of the mucous membrane, which is seen to extend from the epiglottis to the arytenoid cartilage. Anteriorly, it is limited by the upper half of the epiglottis, and posteriorly, it is bounded by the interarytenoid fold of the mucous membrane. So this is about the inlet of the larynx or the laryngeal inlet. The inlet is lined by the non-keratinized stratified squamous epithelium. So this is about the inlet. The inlet allows the opening of the cavity deep to the larynx. Now, when we look on to the cavity of the larynx, the entire cavity of the larynx is divided. The cavity of the larynx is divided into three parts. Cavity is divided into three parts by the two folds which are called as the vestibular fold and the vocal folds. The vestibular and the vocal folds of the larynx divide the entire cavity of the larynx into three parts, that is the vestibule of the larynx. The first part or the upper part is called as the vestibule of the larynx, or it is called as the supraglottic part. It is also called as the supraglottic part of the larynx. Then next, the intermediate part is called as the sinus of the larynx, or it is called as the glottic part. And the lower part is called as the infraglottic part of the larynx. The lower part is called as the infraglottic part of the larynx. So this is how the cavity of the larynx is divided by the two folds, that is the vestibular and the vocal fold. In this picture, is the diagrammatic view where we can make out the cavity of the larynx. As I have just now mentioned, this is the cavity of the larynx, which is seen to extend from the laryngeal inlet till the lower border of the cricoid cartilage over here. Now this entire cavity of the larynx is divided into three parts. That is the upper part, the intermediate part over here, and the lower part seen here. This upper part of the larynx is called as the supraglottic part, which is seen to extend from the inlet, laryngeal inlet above, and is limited below by the vestibular fold or the vestibule, which lies where the vestibular ligament is located. So deep to the vestibular fold lies the vestibular ligament. So this vestibular fold are nothing but the fold of mucous membrane which contains the vestibular ligament deep to it as seen. So this part is called as the supraglottic part, or it is called as the vestibule of the larynx. So this is the vestibule. Now, the area which lies between the two folds, that is the vestibular fold and the vocal fold over here. This is the vocal fold. Now, we can make out a space which is seen between the vestibular fold over here and the vocal fold. Now, this space over here is called as the sinus of the larynx. This space is called as the sinus of the larynx. Now, this is called the sinus, or simply the intermediate part of the larynx. Now, this is that part of the larynx which is devoid of the membrane on either side, which is devoid of the membranes, that is the quadrate membrane above and the cricovocal membrane below. So, the absence of the mucosal folds in this area allows the mucosal membrane lining the cavity to project outward, making up the saccule of the larynx. The mucous membrane on either side of the sinus is seen to be projected outwards, permitted outwards to make up the saccule, which extends upwards to and backwards to reach the lamina of the thyroid cartilage. This saccule of the sinus, the saccule which is present in the sinus, contains the mucosal glands. They contain the mucus glands. The mucus glands mainly functions in lubrication of the vocal fold. So, the lubrication of the vocal fold is mainly provided by the secretion of the mucosal glands present in the saccule. So, this is about the intermediate part or the sinus of the larynx. Moving on to the lower portion of the cavity of the larynx, which is called as the infraglottic part, or it is seen here, that is the area of the laryngeal cavity which is extending down from the vocal fold till it reaches the lower border of the cricoid cartilage, where it is seen to be continuing with the trachea. So, this area makes up the infraglottic part of the larynx, or the lower part of the larynx. So, as we can see, the supraglottic part is roughly funnel shaped. The infraglottic part is cone shaped space or the cavity. So, this infraglottic part is limited above by the vocal fold, and below it is limited up till the the lower border of the cricoid cartilage. So this is about the infraglottic part, which is related on either side by the cricovocal membrane. So this is about the cavity of the larynx. I repeat, the cavity of the larynx divided into three parts: the supraglottic part, which lies above the vestibular fold, the infraglottic part, which lies beneath the vocal fold, and the sinus, that is a space in the cavity which lies in between the vestibular and the vocal fold. A area which is seen between the two vestibular fold is called as the rima vestibuli. So this rima vestibuli is nothing but the space which lies between the adjacent between the two vestibular fold. In the same way, a space which is seen between the two vocal fold is called as the rima glottitis. It is called as the rima glottitis. So this is the rima vestibuli above and rima glottitis below the sinus. So this is about the interior. The rima vestibuli mainly functions to permit the air entry in respiration, and it prevents the exit of air during expiration. Henceforth, this rima vestibuli is also known as the exit valve of the larynx, as it is called as the exit valve due to its function, as it permits the air entry during inspiration and prevents the air exit during expiration. So this is the exit valve of the larynx, that is the rima vestibuli. Whereas the rima glottitis is called as the entry valve. The rima glottitis is called as the entry valve of the larynx, as this rima glottitis permits the air exit in expiration. I repeat, the rima glottitis permits the air exit in expiration and prevents air entry in inspiration. Henceforth, it is called as the entry valve. It acts as the entry valve. One can hold the breath at the end of the expiration, which is done by the rima glottitis. So this is the rima about the rima vestibuli and rima glottitis. Simply, rima vestibuli acts as the exit valve, whereas rima glottitis acts as the entry valve of the larynx. Now here, this is the atlas view where we can appreciate the interior of the larynx. The epiglottis in this is the posterior view of the larynx, which is opened up. We can make out the entire epiglottis, the arytenoid cartilage, the thyroid cartilage, that is the posterior lamina of the cricoid cartilage, which is visible here. We can make out the epiglottic fold making up the lateral wall of the laryngeal inlet. Moving on to the nerve supply of the larynx. The nerve supply of the larynx has got the sensory nerve supply, the motor nerve supply, and the secretomotor supply of the larynx. The nerve supply of the larynx, as we have seen, the area of the larynx which lies above the vocal folds has got a different supply, and the area of the larynx below the vocal fold has got the different nerve supply. So that part of that is the mucous membrane which lies above the vocal fold is supplied by the internal laryngeal nerve. Internal laryngeal nerve is the nerve which supplies the larynx above the vocal cord, whereas the mucous membrane which lies below the vocal fold is supplied by the recurrent laryngeal nerve. This is about the sensory nerve supply. When we need to know about the motor supply, that is all the muscles of the larynx. All the muscles of the larynx are supplied by the recurrent laryngeal nerve, except there is exception, except the muscle that is cricothyroid, which is supplied by the external laryngeal nerve. The cricothyroid muscle is supplied by the external laryngeal nerve. So all the muscles of the larynx has got the nerve supply from the recurrent laryngeal nerve, except the cricothyroid muscle, which has the nerve supply from the external laryngeal nerve. There is a muscle that is the only unpaired muscle of the larynx, which is the transverse arytenoid, So this transverse arytenoid muscle has got the dual nerve supply, that is from the recurrent laryngeal nerve and also the internal laryngeal nerve. So this transverse arytenoid has got the dual nerve supply from the two nerves, that is the recurrent laryngeal as well as the internal laryngeal. So the secretomotor supply of the laryngeal glands is derived mainly from the recurrent laryngeal nerve. So this is about the nerve supply of the larynx. Moving on to the blood supply of the larynx, the part of the larynx which lies above the vocal fold is supplied by the superior laryngeal artery. The area above the vocal fold is supplied by the superior laryngeal artery, whereas the area below the vocal fold is supplied by the inferior laryngeal artery. The superior laryngeal artery is the branch of the superior thyroid artery, whereas the inferior laryngeal artery is a branch of the inferior thyroid artery. So this is about the blood supply. The veins correspond to the arteries as well. Moving on to the lymphatic drainage of the larynx. The lymphatics above the vocal fold, that is the lymphatics above the vocal fold, is drained by the prelaryngeal and the jugulodigastric lymph nodes. Prelaryngeal and the area above the vocal fold are drained by prelaryngeal and jugulodigastric group of lymph nodes. That is, and the area below the vocal fold, is drained by the pre and paratracheal group of lymph nodes. So this is about the lymphatic drainage of the larynx. Therefore, the rima glottitis, that is the area between the two vocal folds, the rima glottitis acts as the watershed line of the larynx, as all the supply above this vocal fold is different from that of the area below the vocal fold. So that's all about the nerve supply, the blood supply and the lymphatic drainage of the larynx. Lastly, moving on to the clinical importance or the applied aspect of the larynx. The vocal nodules is the commonest condition seen in the larynx. It is mainly seen in the persons or the individual where there is maximum use of the vocal cords, where the profession of the person is mainly involved in the overuse of the voice. In such cases, in such patients, what happens is during the vibration of the area of the maximum contact between the vocal cord, which is mainly seen at the junction of the anterior 1/3 and the posterior 2/3. These are the vocal cords. The vibration, the maximum point of vibration between the vocal cord is at the junction of the anterior 1/3 and the posterior 2/3, and thus this is the area of the maximum friction. And in such patients, this area In this area, there is the development of the inflammatory nodules which are named as the vocal nodules. So, the vocal nodules are the inflammatory nodules which is seen along the vocal cords at the junction of the anterior 1/3 and the posterior 2/3, which is mainly seen in the patients or individuals where there is overuse of the voice, like in case of teachers, the singers, etc. So this condition, the inflammatory nodules, which is known as the vocal nodule, also called as the singer's nodule or the screamer's nodule. The size of this nodule vary from the pinhead size to that of the pea size, and initially it is reddish and soft in texture. Later on, the nodules turn up to be white and grayish. Next is the laryngoscopy. The laryngoscopy is the procedure where the interior of the larynx is inspected. There are two types, where one is called as the direct laryngoscopy, the second is called as the indirect laryngoscopy. In case of the indirect laryngoscopy, the interior of the larynx is visualized through the laryngeal mirror, and the following structures are visualized, like as we can see in this picture. This is the parts of the larynx which can be visualized under indirect laryngoscopy, which include the base of the tongue, the epiglottic folds, that is the glossoepiglottic folds, the vallecula on either side of the folds. We can also appreciate the vocal fold, the sinus, the vestibular fold, and the tracheal rings. The cartilages, the paired cartilages, are also visualized. So these are the structures to be seen under the procedure, that is the indirect laryngoscopy. There is one more condition which is called as the laryngocele. This laryngocele is mainly seen in the persons like the weightlifters or trumpet player, wherein if the air pressure in the laryngeal sinus is raised too much in such patients, in such individuals in who are mainly involved in the blowing exercise, when the air pressure in the sinus of the laryngeal cavity is increased, the saccule dilates to produce an air-filled cystic swelling. As we can see in this picture, the saccule of the larynx is dilated to make up the air-filled cystic swelling, which is called as the laryngoscale. This laryngoscale may be internal or external. In case of internal laryngoscale, the cystic swelling is concised within the laryngeal cavity, whereas in case of external laryngoscale, the saccule is seen to herniate through the thyroid membrane and comes outside the larynx. So this is about the laryngocele. The tuning fork of the larynx is the name given to the muscle, that is the cricothyroid. Yes, the cricothyroid is an important muscle which is mainly involved in the maintenance of the tone and pitch of the voice. The cricothyroid is the muscle which is involved in maintaining the tone and the pitch of the larynx. So this cricothyroid muscle is called as the tuning fork of the larynx, as it tenses the vocal cord and make it ready to vibrate like that of the tuning fork. So hence called as the tuning fork of the larynx. Hence the paralysis of this muscle following the external laryngeal nerve lesion may alter the voice quite significantly, especially this condition is noticeable in case of singers. So that's all about the clinical importance of the larynx. So in this video, we have studied in detail about the cavity, the nerve supply, the blood supply, and the clinical importance of the larynx. Thank you.